Good evening to many, good afternoon to others. Dr. Ulysses Burley, and I'm joined by my co host, Khadijah Abdullah.
Hello. Sound like peace and blessings.
And I want to welcome you all to It's Not Over, facing COVID 19 today. It is indeed not over. We have been faced with a bevy of challenges over the last year and a half, and now we have been presented with new challenges in the form of the Delta variant that has changed the way in which we think about COVID 19, the vaccines, and the ways in which we interact with each other. And so today we hope to be able to further broach this conversation around where we are in the pandemic and how it is that we continue to face COVID 19 responsibly in a way that works for everyone and that works for everyone's belief systems. And so we want to also be sure that this is not just a conversation about a disease or about biomedicine. It's also a conversation about our faith and our belief systems and how all of these things intersect together to get us to wellness. And so at this time, I want to give a brief overview of the COVID 19 Prevention Network Faith Initiative, of which I and Khadijah are both ambassadors of. And then we are going to get into our conversation with a distinguished and dynamic panel of medical science experts as well as faith leaders. So again, I welcome you to this conversation where, as you can see, we have a host of experts, of faith leaders who will today try and further elucidate the situation that we find ourselves in over a year and a half after the onset of the COVID-19 pandemic. Again, my name is Dr. Ulysses Burley, and I am an immunologist by primary training with specialty in HIV and AIDS, but I have done this work of COVID-19 for the better part of the last year. I am the founder of You Be the Cure, which is an organization that operates at the intersection of faith, health, and human rights, where we treat people and not just disease. And since August of 2020, a year ago, I have served as a faith ambassador for the COVID-19 Prevention Network Faith Initiative. The COVID-19 Prevention Network Faith Initiative is a faith community engagement strategy where 7 faith ambassadors who are geographically distributed across the United States, who also have the ability to speak into this intersection of faith and science, have been coalesced and for over the last year have established and enhanced networks of faith leaders to conduct and COVID-19 and COVID-19 Prevention Network educational activities around the virus, but also around the vaccine so that people can have the information and the education that they need to make a decision for their families. Currently, consultants are geographically distributed all over the country, and we have been working together to bring information to the most vulnerable communities, mainly Black, Latinx, and Native and Indigenous peoples for over the last year and a half. A part of our mandate is to establish these faith-based networks. We have an advisory council that we call on for leadership. We've been able to implement faith-focused COVID and COVPN educational programs that integrate anti-racist, anti-xenophobic, anti-homophobic, and good participatory practice principles. This event is one of many events that we have hosted over the last year to try and bring you, the community, the information from the experts that you need to continue to be able to do what's best for your family. At this time, I invite my co-host to introduce herself and tell you a bit more about the COVID-19 Prevention Network Faith Initiative.
Thank you, Dr. Burley, and good evening. Assalamu alaikum, peace and blessings to everyone that's watching tonight. So happy you're here with us on a Tuesday evening at 6 p.m. Eastern Time. So my name is Khadijah. I'm the founder of Rahma, which means mercy in Arabic, and our goal is to work with people and address HIV and AIDS, gender-based violence, FGM/C, and sexual health in faith communities. We're also the founder of Faith HIV/AIDS Awareness Day, which is coming up this month on the last Sunday in August. So please come through and do something in your community to address stigma and raise awareness in your community. You can do it virtually, you can do it on the ground, but the goal is to address HIV stigma in faith communities. We have something really exciting to show you on this date, so stay tuned to learn more about it on Faith HIV/AIDS Awareness Day. We're on Facebook, so go to our Facebook page at Faith AIDS Day and stay tuned. I'm also the founder, I'm also a faith ambassador of the Friendship Network and along with Ulysses. And our goal again is to educate the community, especially faith communities, on COVID-19 and provide accurate, up-to-date information on this, on COVID-19. And additionally, I'm also studying now. I got into grad school. I'm studying to get my MPH. So I'm really excited about that. So what do we do in the community in regards to engagement? So we make sure we provide educational materials that are really scientifically backed, that are not hearsay, that are not theories, but actual based information that is scientifically backed and studied by experts. And make sure that we're very inclusive of all people. So we make sure we have, we find common values in different religions, and that we are anti-racist, anti-xenophobic, anti-homophobic, and we tried our best to make sure we're inclusive. And then our goal is to kind of deploy this information across the U.S. to different communities. So we have 7 faith ambassadors, as Ulysses said, and our goal is to kind of raise awareness and make sure we're giving our communities a chance to learn. We know we have people who are sometimes hesitant to past history, so our goal is to really help ease those fears and get information. Next slide, please. So we want to call to faith leaders to please come out and help get the word out to your communities, educate and raise awareness. What you can do is invite myself or Dr. Burley or someone else from our team to come to your community and do an event like this or something else that's very similar and bring information to you. We can pull scientists, we can do it in English, we can do it in Arabic, we can do it in Spanish, whatever you need, make sure we have it for you. And want to encourage your congregation and community to follow the current guidelines. We know that people are getting vaccinated, which is really awesome, you're getting your vaccines, but COVID-19 is still here. And it's not going anywhere anytime soon. So make sure you're still masking up, make sure you're still following the guidelines. So it's very important that we're still very vigilant in what we're doing to keep healthy. Go ahead and go to preventcovid.org for more information about what we're doing, and hope to see you soon. Oh, and of course, you can contact me or Ulysses. Here are our emails here on this last slide. Email us and we will be happy to work with you to help you during this crisis. All right, I think it's time for us to get started. As we mentioned, COVID-19 is still here and it's not over yet. We know we have Delta variant. We know people are still not getting vaccinated just yet. We know that children are vaccinated, so it's still here. We still have work to do. Before we get started, I wanted to invite someone onto the screen who actually survived COVID. They were in the ICU for a very long time. We were afraid, they're going to make it or not. So they want to share their experience with you and just, how they overcame these different things and what they're doing now to stay healthy. So I'd like to welcome Imam Hassan Amin onto the, I want to say stage, but onto the screen. Assalamu alaikum. Can you hear us? Oh, I think he might be a little frozen. So we're going to take him off for now. And we're going to add him back in a minute or two. But for now, to keep going with the show, we're going to have Imam Abdulaziz come on. And he's going to share with you some great work he's been doing in his community. He's been doing surveys, doing PPE, getting people vaccinated. So we want to hear from him, what he's doing to really help keep our communities healthy and safe. So please welcome Imam Abdulaziz to the screen. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. How you doing?
Good, alhamdulillah. How are you?
Alhamdulillahi rabbil alameen.
The floor is yours, dear brother. Please go ahead and share all the things you're doing that's so amazing in your community.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم الحمد لله رب العالمين. Assalamu alaikum. So I want to just begin by thanking Sister Khadijah, Dr. Ulysses, and all of those who are on this panel today, and for the work that they've done to get information to the public, to share on the basis of doing some community assist by virtue of us staying on this serious issue. We want to just say that we appreciate the COVID Prevention Network. They're doing some wonderful things, and we pray Allah subhanahu wa ta'ala blesses us to get the most out of this networking. And to that we say Ameen. This particular area in which we sit is reported to be one of the areas out of the three-quarter area containing high transmission levels of COVID-19, the current COVID outbreak, which is the Delta variant. This particular community is composed of a lot of immigrants, African Americans, Hispanics, some documented, some undocumented, a lot of elderly. That was the focus of our first group of surveys. We were only able to go through about 65 of them to be able to make the time on this, but there are so many other surveys that were done, and we're still doing them because we were specializing and focusing on this particular group. And this age group stemmed from ages 23 to the age of 98 years old. And many of the people that we surveyed were people who lost someone, may have had COVID, and so on and so forth. And so what we did was we took the group of 65. We stopped there because we didn't have enough time to go through all of the numbers. And so what we did was we looked at the 55 African Americans, 10 Hispanic, 0 Caucasian. The gender was 39 female and 26 male. Now, the purpose of this survey is for us to find out where our community is coming from, to put our hand on their pulse. We have a pantry here that we service anywhere from any day, but it's namely on Friday, specifically on Friday, in which we service anywhere from 400 to maybe sometimes 1,000 people. During this time, we were able to do some surveys, but we couldn't do a bunch of them because there's a lot of, with all those kind of people around you, there's a lot of other stuff going on. So the focus really is on giving out face masks and things like that, along with the food. And so we took this survey because many people that when we were giving out the vaccine here, there was a lot of people that were very interested, but then there were people that were standoffish that said that we're going to wait just to see how things work out. And we wanted to see how this thing was going. And so out of those people that were vaccinated, out of the group that we surveyed, 39 were vaccinated and 26 were not. And many of them, out of the 65, only 28 had family members that were vaccinated. Now, many of them said that they would not be vaccinated. They said no, they refused. There were 8 people that wanted it, 7 were undecided, 10 outright refused out of the 26. And then they were talking about the average answer to the question as to why wouldn't they take the vaccine is that their response was mistrust. That was the average response, or something that meant that. Then the question was asked, did they know anyone who had COVID? All of them, out of the 65, 57 knew someone who had contracted COVID-19. They were asked did they practice social distancing, and they all stated that they did so. They said, did you think wearing a mask was helpful? Many of them all agreed that it was helpful. Did you go out for work and visit family? 40 people surveyed said that they go out. 5 of them had remained home, and some say they don't go visit family. 20 of them said we don't go visit family at all. 5 of them were remaining in place, that I actually spoke to them outside of the mosque, outside of the pantry. I spoke to them at their home or at their door when we're dropping off food to them. We're asking them these questions on the survey just to see where they were coming from. They were asked how cautious were they. 55 said they were very cautious, and the other 10 said they were not too cautious. Do you attend religious services? 65 service, 40 go out, 25 stayed home. Don't attend any services at all. The average size of these families that we surveyed was an average size, 3 to 5 people in the family. But there were other family members that were bigger. There were some families that had 10 people in the family and no one was vaccinated, and they weren't even thinking about it. Many of them said out of the question, do you think the vaccine will help return us to normal? 45 said yes. Whereas the other 20 said, no, we don't think it ever returned back to normal. Do you think the COVID-19 was man-made? 7 believe that it was man-made, according to the survey. But the majority of people that was mentioned, that was spoken to, they didn't think so. Has faith played a part? We asked that question, did faith play a part in them surviving during the COVID? 65 out of the 65 said faith had something to do with it. Do we encourage others to remain safe? All agreed that they encourage others to remain safe. The last question on our list was, have you lost anyone due to COVID-19? Out of the 65 people who took the survey, 30 of them out of the 65 lost someone. And each one of them that lost someone disclosed that they took the vaccine after they lost someone. The ones that haven't taken it, that say they don't want to take it, they haven't lost anyone, but they know someone that has died of COVID-19. So my question to them was, which will be considered worse, the COVID or the vaccine? And so what we've done here is we're just this is just the tip of the iceberg. We're not even finished with the surveys that we're going to take. These surveys were random surveys, but we looked at a particular age group. We only had one person that was in their 20s. The average person during this survey was in their 70s. They were a grandparent, retiree, a person that had diabetes or some other illness. Some people during the survey also felt as though they didn't have to take the vaccine because their immune system was all right for 70 years. Mm. Okay, so we have this out there, and there's a lot of other talk that's out there that's developing mistrust. But I'm telling you, nothing has made us take a closer look at this more than those people who were vaccinated because someone died in their home. Mm. And so it's my humble prayer that the COVID Prevention Network, Sister Khadijah, and our group will continue doing this and finding out a little more about this. This was our first one. We have several others that we're going to do. We're going to be targeting our youth group and people like that, where we're going to be talking to them specifically, and we're going to see in ways in which we can help them understand the need to make sure that they tie their camera. May Allah help us to that. We say, Ameen. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much.
Thank you, Imam Aziz, for sharing that powerful testimony in your survey results. It's just interesting hearing this. And we know some of this already, this is probably our work, but actually hearing these results and you doing this work, it just kind of shows the fact that we need to continue doing this work and really educating our community. So thank you so much for doing this and all your hard work.
Allahu Akbar. Thank you.
Thank you. So now we're going to try to bring on Imam Hassan, and let's see if we can get this camera going. Assalamu alaikum. Can you hear me? I think we're still having some slight difficulties here. So what we're going to do is we're going to try again in a minute and see what happens. I think a little bit of a connection issue here. So in the meantime, we're going to bring on some of our guests for tonight and start having our discussion. We had some questions sent in to us in advance. We're going to go ahead and answer those questions. And if you have questions that you want to ask the panelists, please go ahead and put them in the comments now. We're going to bring on a nurse practitioner. We're going to bring on a doctor. We're going to bring on some scientists. And our goal is, and some faith leaders, and our goal is to really hopefully to address your concerns, to talk about what's going on currently, with COVID-19, Delta variant, and different things that's been going on. So please, I'm going to welcome to the screen now Sister Candace, Dr. Zindelman, and Imam Abdulaziz come back as well, and Dr. Simmons, and we'll try Imam Hassan again in a bit. So we'll go ahead and get started for now with our questions. Welcome, everybody. So I want to go around and ask you all to say 1 minute or less something about yourself. People know who you are, why are you doing this work? So I'll start to my right, and we have Sister Candace.
Assalamu alaikum. Hello to everybody. My name is Candace Elam. I'm a family nurse practitioner, and I will be working in primary care in the Bronx, New York. My professional experience is in emergency nursing, HIV clinical trials research as well. And I am doing this work because I'm seeing not a whole lot of people, not as many people as I would like to get vaccinated. I'm a mother of a preteen and a teenager, and my little one, he can't get vaccinated. So I really do need the adults and the adolescents around him to protect him from this virus, because all he's got is the mask and Allah.
Thank you so much, Sister Candace, for sharing your testimony. Dr. Zindelman, can you go ahead and share with us, who you are, represent, and why you're doing this work?
Sure. Thank you. Thank you, Khadijah. And nice to meet you, Candace. Your son will get vaccinated soon. I'm Jonathan Zindelman. I'm an infectious disease physician, professor of medicine at Johns Hopkins. I've been at Johns Hopkins for 32 years. As you may be able to tell from my accent, I'm originally from New York. I have been doing infection. I worked in inner city Baltimore working in the STD program for 30 some odd years. I started my career, my internship 40 years ago, taking care of some of the first AIDS patients in New York. And now, as I'm sort of towards the end of my career, I have a second pandemic, and I've been working in community health for all of my professional life.
Thank you so much for joining us and for all the work you've done over the years. Much appreciate it. Imam Abdulaziz, please go ahead and introduce yourself and tell everyone where you're from. You're muted.
Okay, assalamu alaikum. My name is Imam Abdulaziz. I am from the Al-Masjid Adam, the Community Life Center for Human Excellence, in which I'm the resident imam. I'm also the president of Ashifa Incorporated. And what we do is at the masjid here, we have kind of, if you will, transformed the space that Allah has blessed us to have into a place where everybody can basically come and get whatever they need. So it's like a one-stop shop here. We have a senior center. We have a place where they can come get something to eat, place where they can, get referrals. We have a janazah station here. We have quite a few things going on besides the masjid. So when they ordered us to close the masjid for the COVID, when it really got bad here in New York City, we just continued to operate out of the senior center, which is downstairs. And Allah had blessed us to get it completed just in the nick of time. But our efforts is just not only to be here for the Muslim community, but for the general community surrounding area. And this surrounding area happens to be an area that has been highly affected. Widespread deaths due to COVID-19 in this particular area. This is one of the worst areas. And it was also a very high poverty area. And so we had to do something, and Allah blessed us to be able to do this little bit of work. We want to do so much more. This is why we're happy to be a part of what you're doing. But what we're doing here happens to be a part of an urgent need. Here, we had the vaccinations here. We also had testing here. We're going to bring them back here. We were talking today about the possibility of bringing the vaccinations back to the location here and also bringing them back, the testing back here. And so with that being said, we're just here trying to be of some service during this tough time. And we pray that all of you remain safe and that you also continue to be of some service as well.
Awesome. Thank you. Thank you so much for all that you're doing. We're going to go ahead and get started with the questions. We have several here, so make sure we have enough time to go through them all. So the first question is for Dr. Zimmerman. The question is, will the vaccine affect my immune system?
Hold on, my wife is calling me.
No problem at all. Real life stuff, y'all. Okay, so we're gonna go ahead.
I'm okay. I'm okay.
Okay.
Now. I didn't tell her I was home, and she was wondering where I was.
No problem.
Okay, can you repeat the question, sister?
Sure. The question was, will the vaccine affect my immune system?
Sure. Okay, great question. And one of the things which I forgot to mention, is I'm also involved in the safety monitoring for one of the major vaccine programs. So I have firsthand knowledge of the data. The vaccines, and this is any of the vaccines, will not affect your immune system at all. And in fact, so we've heard some people be concerned about, will the vaccine weaken my immune system? We've seen people, especially on TV, saying, I have a strong immune system, I don't want a vaccine. I think, as we heard from some of the testimony before, that's really not that is an incorrect assumption. We've heard concerns about especially the vaccines are mRNA vaccines, will it affect my immune system that way? The answer is not at all. Many people have reactions to the vaccine, usually with sore arms or sometimes fevers and chills for a day or two after the vaccine. That is actually your immune system responding to the vaccine, and your immune system making the antibodies that we need. So the short answer is no. The longer answer is when your immune system responds, we get some of these side effects which are absolutely expected and which actually demonstrate a healthy response.
Thank you. Thank you so much. So this next question can be either Sister Candace or Dr. Zimmerman again. But the question is, people are vaccinated, but they're still getting COVID. So why should I get vaccinated if I'm going to get COVID anyway?
Sister Candace, I'm happy to let you, or if you want to punt to me, either way.
Sure, I guess I can start. So what the research has shown us is that the likelihood of contracting COVID-19 with the vaccine is still drastically lower than if you were unvaccinated. One of the things that we need to bear in mind is that the endpoint for whether the vaccine works, when we say that a vaccine is effective, like, what does that mean? And when we're talking about these particular vaccines, we're talking about preventing severe infection leading to hospitalization and death. So an asymptomatic infection doesn't count towards the question of, does this vaccine work? Or a mild infection doesn't count towards the question of, does this vaccine work? The bottom line is, did the vaccine prevent you from being hospitalized? And did it prevent you from dying? And that's how we know that it works. So yes, people who have been vaccinated have been known to get mild infections, asymptomatic infections, not generally the kind that lead to hospitalization and death. So the vaccine is still working.
Yeah, and I will add to that 99+% of the people who have died from COVID have not been vaccinated. And also the vaccine also prevents, even if you get a mild infection, your ability to transmit that to other people is substantially reduced as well.
Thank you for that clarification.
It wasn't clarification. She did not need clarification.
No, for both, in general, for the whole question, not like for you, but like in general, like answering that question that people can still get it there to get the vaccine. That's what I meant. But thank you. So the next question is, I've also heard that people who have the vaccine are also dying. So again, why should I get it if people are also dying? How will it protect me?
So I would say there's a couple of reasons that may occur. One is if you're fully vaccinated and you've had enough time to get the immunity, which for the Pfizer and Moderna mean two injections and 2 weeks after the second injection, or the J&J, you've had the single injection and it's 2 weeks after that. You need that full time for your body. Think about the way vaccines work. The vaccines are not a miracle drug. What the vaccines do is they cause our bodies to mount an immune response, which then is ready when they're exposed to the virus. It takes a couple of weeks for our bodies to mount the right amount of immune response. So if I get vaccinated today and get exposed to COVID tomorrow, I'm not protected yet. I'm not protected until I'm all the way downstream. And we've heard, and we've seen stories in the news and on CNN about how people who get quite sick and they want the vaccine now, and the doctors tell them, listen, honey, it's too late at that point in time, because your body needs a couple of weeks in order to respond to that. So that is the most common reason why that's occurred, either because they've only gotten one shot, or they haven't had enough time after the second shot as well. There's another group, which is, let's say if you have an organ transplant, or if you're on cancer chemotherapy and you're immunosuppressed, severely immunosuppressed, those folks may not respond enough to a vaccine. And that's one of the reasons why we all need to be protective, because there are people like that in our community who we really don't, and unless there's somebody close to you, they're not going to advertise that fact. So they may not respond appropriately. That's just a small number of people, though.
If I could just add one more thing, there's also a minority of folks who, we have to distinguish dying after the vaccine and dying because of the vaccine. And this is something that we saw a lot of in HIV clinical research. For instance, I had one research participant who got bitten by like a hamster, so it was just a bite by like a small mammal. And I had to write down that there was a mammal bite that took place, and that there was an infection and a hospitalization and a whole bunch of new drugs. And of course, the principal investigator of that study had to determine what was this whole stream of events related to the investigational new drug or not. And obviously, that the fact that the research participant was taking an investigational drug did not lead to the hamster bite. But anything that happens to people who are involved in investigational new drug research has to be documented. If they trip down a flight of stairs, if they get into a car accident, if they get struck by lightning, or if they get bitten by a hamster, all of it goes into the study data. And then there's a determination of whether it's related or unrelated to the product. So it's important, when we say that this person passed away after they took this drug, it doesn't necessarily mean because they took this drug.
Right. Candace, that's a great point. And I think another way of looking at this is, if we vaccinate 100 million people, what's the likelihood that let's say there's 5 million people who are between the age of 55 and 60. What's the likelihood that somebody tomorrow is going to get a heart attack just because that was their time? And it doesn't mean, and so by chance, as we do more and more people, the stories that come out are the stories exactly like Sister Candace mentioned. On the other hand, when we're doing vaccine safety monitoring, so for example, in the study that I'm involved in monitoring, we have 44,000 people that we're monitoring, and we look for these types of events. And the question to specifically to Candace's point is, are the numbers of cases of adverse events or complications higher in the vaccine group than in the control group? And the answer to that for these vaccines so far has been absolutely no, with some very, very, very minor exceptions.
Thank you for sharing that as well. And we have some follow-up questions actually in the chat about the vaccination. So I'm going to go ahead and put that up now. I think it's kind of relevant to our discussion that we're having. So let's go ahead and put this up. It's from Joyce. She's asking, after being vaccinated, how often should you get tested? I was told to get tested if I experience symptoms. What if you are asymptomatic? Should you get tested on a regular basis? Anyone feel free to respond. It's an open question.
Generally, we don't recommend you should get tested unless you have a specific exposure, or if you have upper respiratory symptoms which are consistent with COVID. If you're asymptomatic, unless you have a high risk exposure, for example, a family member, somebody who you live with who's had COVID, who's been diagnosed with COVID, there's no reason to get tested specifically for that. And we would not recommend getting tested on a regular basis.
Thank you. So our next question is, what is the Delta variant and how can I protect myself from it? And again, open to, and we'll jump right in and answer this question.
So the Delta variant is the COVID remix. It's our new version of COVID-19. It is much more transmissible. In other words, it's more contagious than anything we'd ever seen before. Almost like a remix. You know, the original song is, you know, it gets people, but that remix is something else. So more contagious, the disease itself is more virulent, and we are seeing breakthrough infections with the Delta that we hadn't seen as frequently with the prior versions of COVID-19. How to protect ourselves? We've still got the same itsy bitsy basket of things that we had from the start. So of course there is masking, there's hand hygiene, there's social distancing, there's ventilation, which for the most part, individuals don't have a whole lot of control over ventilation. You go to work, the HVAC system is what it is, and there really isn't a whole lot that you could do about it. But 3 things I just mentioned, and then of course there's our vaccine. So we've got 5 things and testing. So we've got 6 things in the basket: masking, ventilation, social distancing, hand hygiene, vaccination, and testing. And these are the ways that we protect ourselves and our families from it.
Candace, I'd like to just add to that to say that the only reason why we have variants, and variants are essentially mutations, they're mistakes made by the virus when it replicates itself, is because we don't have herd immunity yet within our population. And so vaccination becomes even more important to prevent against other emergent variants, right? There are at least 4 or 5 other variants that are of concern to the United States that are being monitored: alpha, beta, gamma. Delta is just the most transmissible right now, and it has become the dominant strain in our country. But we've also heard of emerging Delta plus variants that we've seen now in South Korea that might even be more transmissible than the Delta variant that we're seeing. And the reason why these variants exist is because the virus has been allowed to infect people, to replicate itself. In doing so, it makes mistakes, mutations. Sometimes those mistakes are good mistakes. It cancels out itself. The virus dies there and is able to spread. But sometimes the mutations result in this new strain that has adapted, that has evolved, and then it gets passed on to people. As long as we don't have the coverage from SARS-CoV-2 in our population that will not allow for vaccines to continue to replicate, to continue to jump from person to person, we will continue to see these variants. And so it's really important, because the more people who are vaccinated, the more people who are protected from SARS-CoV-2, the less chance we have of a mutation evolving that could then cause the situation that we're in right now. So, you know, it's more dire now than it was in terms of why the vaccines are important, especially now that we know the vaccines work, from keeping people sick and keeping people out of the morgue, right? But even more than that, the vaccines are important to make sure that we don't see emerging variants that might potentially be even worse than Delta, and that they're not only more transmissible, but they're also lead to more severe illness, which is yet to be seen with Delta. And so I really want to note, in addition to everything that you said, vaccinating people allows for us to protect ourselves against variants that would otherwise mutate and making mistakes, and then jump from person to person to where now we have this dominant strain. And so, it's more than just protecting your individual self and protecting your neighbor. It's really also getting ahead of the science that up until this point has been ahead of us.
Mm. Thank you.
Could I add another point to that really quick? Just exactly what was already stated. I agree 100%. I think one thing that a lot of folks don't understand is that when viruses are replicating, they're always making mistakes. And we can take advantage of that by protecting as many people as possible, so those mistakes don't get a chance to jump from an infected person to another person who is highly susceptible. That's really literally the only reason why those mistakes even become anything we know about, is because we have those gaps, those chinks in our armor, so to speak, when people are, large populations of people are still not protected with pre-existing immunity with vaccinations, types of protection. I think that's something we always have to keep in mind, that this is something that we've dealt with time and time again with other types of infectious diseases, viruses in particular, that when we have large coverage, those little mistakes that these viruses make will basically we will never even know about them. It would be silent, so we've done it before, and here we are trying to do it again to protect our communities.
So since we have a question that actually came about this, so someone wants to know, like, how is the virus making mistakes? Because we're talking about mistakes and whatnot. So people that don't have the medical background terminology are trying to understand, how does that work?
So think about, let's go back to high school biology. And I know for some of us, that's a long time ago. Remember our genetic code is our DNA. When we grow, when we make new cells, the DNA is making copies of itself. The viruses do the same thing. This virus is a little bit different. And I'm not going to get into the technicalities here, but the virus here, the SARS-CoV-2 virus, the virus that causes COVID, is an RNA virus, which is also we have flu is an RNA virus, and actually HIV is an RNA virus. They're all in different families, and we see these. But when they copy their nucleic acid, their genetic code, to make new copies of themselves, every once in a while there is a mistake. And think about these viruses, which are copying themselves all the time at incredibly high rates. And just think about what we do in the course of our daily life. So if we make a mistake 1 in a million times, and you're copying yourself hundreds of millions of times a day, by chance alone, you're going to have a couple of hundred mistakes, just because that's the way it is. Most of these mistakes end up with the virus dying. And this is true in humans too. We have genetic diseases, which are a result of a genetic miscopying as well. Most of these, in terms of the virus, result in the virus dying, but every once in a while they get lucky, and you end up with as I loved what you said, the remix. That's such a perfect way of framing this. So it's something which is happening all around us all the time, just by chance, and every once in a while they hit the jackpot.
Thank you. And people are saying thank you. It's so helpful with information. So thank you for sharing. The next question we have is, if you are vaccinated and have a mild case of COVID, how would you know you have it? This virus has so many different symptoms, why does it cause so many different symptoms in people?
Well, honestly, there is no way to confirm that you have COVID without a PCR or test or some type of genetic sequencing of the nucleic acid material of the virus. Otherwise, you're basically operating based on symptoms. And like the question suggests, those symptoms are similar to a lot of other things. So in the midst of the pandemic, and I'm sure, most of my colleagues on the call will, agree, you just take precaution. If you feel anything, you immediately stop exposing yourselves to people. And if you suspect that it's COVID or not, you should probably confirm that diagnosis with the help of healthcare professionals and some type of testing. But you're not going to necessarily be able to determine that just based on symptoms alone.
I would actually just make one clarification on that, and that is not only about a third of people have this, but if you lose your sense of taste or smell, that's a pretty good indicator that you've got COVID. Otherwise, actually, it's pretty non-specific. So if anybody, that's a big red flag.
And to add, when COVID emerged, we all thought of it as a respiratory disease. And over time, we've learned that it does not just affect the lungs. It does not just affect the respiratory tract. This is a multi-system disease. So people are getting blood clots in their brain, having strokes, they're having heart attacks, they're getting blood clots in their lungs, and they're losing circulation in their, in their limbs. They're having erectile dysfunction, they're having memory loss, they're having headaches, vision problems. This is a multi-system disease. There is no way to predict what symptoms an individual is going to have and whether they're going to have residual symptoms thereafter. So like Dr. Simmons had mentioned, if you suspect that something has changed in a meaningful way, then for sure get tested and keep yourself away from other people. But it's not just a lung disease. It's so much more than that.
Thank you. We actually have a question about children because we know that there isn't vaccines currently for children under a certain age. So the question is, so people are putting their kids back in school now in the fall, or actually have started already, most likely in some states. So they're wondering how to keep their kids safe if they're not vaccinated. So any insight on that would be really, really helpful.
So let me start this by talking about the vaccine, then I'll hand it over to my colleagues. Okay. So we will see the full license for the vaccine, including kids down to 12, come pretty much. I think we're anticipating this by early September. The data for kids, and this has been accelerated by the FDA, the data for kids, and there are safety studies being done in children, 2 groups, 5 to 12 and 6 months to 5 years. Those data we anticipate will be ready by the end of September. What I've been told is that we may see an emergency youth authorization by mid-October, which is sooner than we thought. Now, no guarantees, but I think certainly by spring semester we'll have vaccines for kids. But I think it's going to be sooner than that. So I think the vaccine, and obviously the most, and obviously once that occurs, then there's a big hurdle in getting all those kids shots. But I think we will have the ability to do that sooner than we thought. But I think basically, sister, basically, I think you can probably comment on how to keep kids safe as being a mom of some school-age kids.
Thank you for that. And I've been praying for the vaccine for children under 12. I've got an 11-year-old and I have a 13-year-old. My 13-year-old got vaccinated in May. And I was just so thrilled to get her vaccinated. It was a huge weight off of our shoulders. So how do we keep our kids safe? First and foremost, especially our ones who are too young to get vaccinated. Those who can get vaccinated, by all means, vaccinate them. I've done so with my own 13-year-old. She did very well, and she's happy to have received the vaccine. My 11-year-old is kind of jealous of his big sister because she can socialize to a greater extent than he can, because we're still kind of keeping him within our vaccination. Oh, Imam is here, and we got good sound. Okay, I'm going to quickly answer this question.
Yes, we can hear you.
All right. keeping our unvaccinated children in that cocoon, surrounded by fully vaccinated adults, is very important. My whole family, my parents, my husband's parents, my husband and I, my brother, we're all vaccinated. So our 11-year-old who is unvaccinated is surrounded by other vaccinated people. That's one of the things that we did in our own family. And we don't socialize in indoor spaces with people who we know are unvaccinated or people whose vaccination status is unknown. As for returning him to school, my plan is to have him double masked. So he's going to be wearing the blue, like paper surgical mask as the base layer, and then a cloth mask over that. And that's as close as we can get to an N95. I know that it fits him well. So double masking is going to be our intervention for him, as well as for his sister who goes to the same school. We're still restricting, indoor activities to the greatest extent that we can. And the moment he turns 12, I've already told him, for your 12th birthday, we're going to the doctor to get you vaccinated. Or if the vaccine comes out prior to that, we're doing that. So, the vaccination cocoon within the family. So he's the only unvaccinated person in the family, and that's because he's not eligible. And then masking and model masking too, because if you're a vaccinated parent and you're still going about without a mask, you have to show your kids how serious it is. You have to role model masking. It's not easy, but whether you personally need the mask or not, they need to see you doing it in order for them to adhere to it themselves.
Thank you. And a follow-up question to that is, for kids who aren't vaccinated, they heard that certain vitamins might help to keep them healthy. Is that accurate?
I think vitamins in general are good, but vitamins specifically are not going to help with this, protect you against, you need generally you need vitamins to have a healthy immune system, but outside of that, there's nothing specific for COVID.
Okay, thank you. And still keeping on the topic of children, we do have some more questions around children and actually pregnancy. So a question we have from the audience is, can you shed some light regarding vaccines and pregnancy?
Sure, I will speak to that because I have some personal experience. Obviously, I haven't been pregnant, but these vaccines are absolutely safe in pregnant women. They're recommended by the American College of OBGYN, which is the group of OBGYN physicians, the doctors who deliver babies. Furthermore, if mom is vaccinated, mom can actually transmit the antibodies, the protective antibodies to the baby, which was very important, especially for the first couple of months of life. We also know that mom can provide antibodies to the baby through breast milk. My personal situation with this is I am very lucky. Now, the reason I'm in my basement is because I have a 3-month-old upstairs. My daughter is living with us, and I'm blessed to have had 2 grandsons in the past 3 months, one on April 13th and one on July 1st. My daughter and my daughter-in-law both got the vaccine, and both did absolutely fine. So this is something which is, and there's been large studies done by the CDC to show that that the vaccines are safe during pregnancy, and it's not only safe, but also there was no problems with the baby. To the flip side, getting COVID, if you're pregnant and you get COVID, as Sister mentioned, this can be a really, really bad disease, both for the mom and the baby. And we have situations where moms have died from COVID in pregnancy because they are much more susceptible to the complications when they are pregnant.
Can you hear me?
Yes, we can hear you, Imam.
Great, sorry.
Do you want to add to that question?
Okay.
And another follow-up question to that was, they wanted to know if they take the vaccine, does it cause fertility issues, like for them getting pregnant later on?
That's also a very common question. The answer is absolutely not. We've also heard about menstrual problems. Also, no.
Okay, thank you. So to Imam Abdulaziz, Imam Hassan, we're happy that you both are here. So from a faith perspective, some people have said they don't want to take the vaccine because they think there's pork in it or other haram or unlawful ingredients. Do you want to share or shed some light on that?
Imam Hassan. We'll refer to Imam Hassan.
I think he's having connection issues right now.
He's having connection issues.
Yeah.
Imam Hassan, are you there? Oh, yeah, he's having connection issues. Well, as to the question, from the research that we've done, that I have been privileged to get, the vaccine in and of itself doesn't have any of those things that would be considered un-Islamic or harmful. The general principle of the religion of Islam is that it's pro-life, and that we should make every effort in medicine, in our own social experiences, to preserve life. Islam is not opposed to science. It's opposed to mad science. It's not opposed to science, but mad science, yeah. And so the religion in and of itself is teaching us that we are supposed to be promoters of everything that helps preserve life. If eating this is good for you, then you should eat it. If eating that is bad for you, stay away from it. Islam is very clear. On the things that are bad for you, stay away. The things that are good, stay away. But when it comes down to the vaccine, in terms of the ingredients, there's really not have been any ingredients that have met that standard, that have went above the standard in which Islam is allowing us to maintain, and that is free of pork products. They were saying this information they were putting out. They were saying that this came from some humans and the fetuses and all kind of crazy stuff they were saying that was in the vaccine. But Islam is saying that none of those ingredients, if none of those things that are harmful are in there, and that they're there to preserve life or to help sustain life, then we should consider taking that or taking medicine to help us improve our lives, becoming more healthy. And then we should be safeguarding ourselves by taking all of those other precautions, like Dr. Candace was talking about, masking up, going out and social distancing, eating the proper things, getting the proper rest that you need, making sure that you're not in the situations that would put you in harm's way, and taking the vaccine. And so this is right along the lines of the Prophet ﷺ saying, have faith in Allah, but tie your camel. I spoke to one of the seasoned members today, a senior. She's about 70, 72. And she said if she had to take the vaccine again, she'd take it again. She said Allah has control over all things, and that He is the one who has the power over all things, and nothing is going to happen unless He wills it. And if I got to take the vaccine again, I'll take it again because I'm feeling good. And she was just fired up. But then you speak to someone else and they tell you, no, man, it's not approved by the FDA, man. No, man, this thing is going to interfere with my immune system. No, man, this thing here, man, I don't know, man. Over 3,000 people died from it. Come on, man, I'm not taking it. So this is a challenge that we have, because I'm hearing all the arguments. I'm hearing all of them. And so, but when it comes down to what Islam is actually saying about medicine that helps preserve life, then this would be considered something that we can use.
Could I speak to something that the Imam just mentioned? Because I think there's a really important point.
Yes.
Because I think you mentioned something that was really important. There are 2 points that I'd like to make. First of all, I'm not Muslim, but I do know I know a fair amount about the different religions, and the Pope, which is a much stricter line on fetal cell research, said that this is okay, even though there's no fetal cells involved in this. But the second thing, which is more important, is that people have said this is not fully approved by the FDA, and that's why, and it's experimental. Let's unpack that a little bit. This did happen really quickly. However, as somebody who's been involved in the safety monitoring these vaccines, I can share with you that this has been some of the most intensively studied clinical trials that have ever happened. When we look at when we were looking at potential, for example, we heard that some people may have had appendicitis, or some people may have had this. We asked them to go back and reanalyze the data, and reanalyze the data, and reanalyze the data. Then, when the emergency use authorization was approved back in November, December, the FDA took all of the data and completely reanalyzed it. Hundreds of thousands of pages of documents were completely reanalyzed, and the results came out the same. The reason we're dealing with something called an emergency use authorization is because there's physically, from a regulatory way, there's no other way right now to approve this. And the emergency use kind of makes people scared because they say it's experimental, it's emergency use. The full license application usually takes 6 to 9 months, but when you're dealing with a public health emergency, the EUA is a different way of getting this out there quickly. But but in my experience, having done this for a while, these things were really, really carefully watched over. And I think the problem is the emergency use authorization language is really it's a bad way of describing it. And it came because of the legislation for this came after the anthrax attacks in 2001, when they realized that we didn't have a way of approving new drugs for an emergency. And that's where this comes from. And I think there's a lot of people interested in reframing this. So I think when the use, the term is a bad one. I think part of the messaging here, which is really important, this is absolutely not experimental. This has been really carefully looked over again and again. And I think we're seeing the results in terms of the success in the folks who've been vaccinated.
Dr. Zillman, can I be even more explicit just to name what's actually in the vaccines, right? It's generally 3 or 4 ingredients. When we talk about the 2-dose mRNA vaccines, you have obviously modified messenger RNA, which we've already heard explained. But then after that, you've got lipids, which are basically fats that are used as a package to deliver the mRNA into the cells, into our bodies. You have salts, which have been used for preservatives, and you've got sugars, and that's it. Some of the other vaccines might have an additional acetic acid or otherwise. All of those things really about the stability of the vaccine after it's produced. But we're talking 4, maybe a maximum of 5 ingredients in the vaccine, and they're widely available. Most of the things that we eat on a daily basis have more ingredients than that, most of which we can't identify and don't know what they are. And so I think it's really just important just to say we know what's in the vaccines, and it's as simple as salt, sugar, and the actual genetic material that's being used in the case of the mRNA vaccines. When we talk about the Johnson & Johnson 1-dose vaccine, it's an adenovirus that is replication incompetent. That means that it can't make anybody sick. Also, it's used as a vehicle, a package to deliver the information, and then everything else is just to keep it stable. And so, sometimes we just have to name a thing, and just to say we know what's in the vaccine. We know exactly what's in the vaccine, and that's more than we can say about a lot of things that we partake in on a daily basis.
Another thing about this whole it's not FDA approved or emergency use authorization, a lot of us buy over-the-counter vitamins or different types of nutraceuticals. I think the new big thing is CMOS. Everybody's like, oh, I got to take my CMOS or whatever it is. Like, none of that is even getting any type of safety monitoring. None of that is even getting monitoring for effectiveness. I was going to take something, I went to Whole Foods. I had something in my mind. Oh, I'm going to take this supplement for this particular thing, spent $35 on it. And I started Googling after the fact, and I'm like, oh my God, this can cause renal failure. You know what? Let me not even use it. And this is a product that the FDA is not at all involved in, because none of those non-pharmaceutical products fall within the bailiwick of the FDA. So whatever you're getting from GNC or Vitamin Shop or this person online or that person, selling, from the back of their car or from their house or from a catalog, like none of that is being monitored. None of that is regulated. You have only to believe what people are telling you, and the person selling it might not even know what's going on. So yes, this vaccine is new. It came together quickly, but we also have to remember that it came together after 20 some odd years of preceding science. Like, this is not the first time that we've seen a lethal version of the coronavirus. We started seeing it back in the early 2000s with the SARS Classic, as it's now being called, taking place in East Asia, and then MERS in 2007 or 2008, which took place in the Middle East. So this is our third rodeo with this, and there's been close to 20 years of science that we're standing on today, which is why we have the vaccine in the first place. And it's being watched for safety and effectiveness at every step of the way. If we did not have a vaccine at this point, the people who are saying that it came together too quickly would now be saying, well, why don't we have anything? What's taking you guys so long? So the fact that we were able to mobilize to this degree and with at this pace has really been a testament to how well people are working together to get this done.
Thank you for sharing all these points. Like, talking about the ingredients, the FDA, the vitamin example, like those are really good ways to think about this when people are referencing it.
Excellent.
Really, really great points. Thank you. Yeah. So those who are watching, we'll be wrapping up within the next 25 minutes. So if you have any other questions, please feel free to drop them in the chat. We have a lot more that came in before the event, and we have a couple more in the chat right now. But please feel free to drop them now. And if you don't get to them today, feel free to email some of the panelists on this panel that you want to talk to and ask them directly. We'll probably provide information at the end of this event. So speaking of reactions, we have another question from the audience. They're asking that they have seen multiple instances of people having adverse reactions. What do you make of all the VAR's reports? Also, how do we know the long-term effects?
Sure. So I'll start with that one. So the VAERS is what we call passively reported system. That means anybody who has a reaction can go online and submit a report. Whether you had a headache, whether you got bitten by a hamster the day after. So it's anything. So I think this is a very crude, what we would call a crude system. It's basically used to identify things which are major signals which cause people to investigate it more. So the VAERS is basically, if you read the VAERS report, you wouldn't, on any drug or any vaccine, you would not do anything, because it's everything that ever happened to anybody. And going back to the point which we made earlier, in that the important thing is, does this happen more frequently in people who get the vaccine compared to people who did not get the vaccine? The only thing that we can say for sure in people who get the vaccine is that you're going to have a sore arm, you may have some fever, you may have some headache or muscle aches, that we know, and that's your immune system responding. Other than that, there's been no major, with a couple of very small exceptions, there have been no major events that have been seen in the vaccines more than in the people who are the controls. In terms of the long-term effects, the long-term effects are going to be seen in people who are each one of these big clinical trials that's being done, and now there's about a half a dozen of them, are following the people for at least 2 years, probably more, and they're going to be followed very closely. So if something shows up, we will see it. However, we know that over 95% of adverse effects from vaccines occur within the first 2 months. If it's going to happen, it's going to be in the first 2 months. Some of the other things that have occurred with vaccines in the past, we've been looking for very intensively, and they haven't been seen. So I think we're confident this is safe. However, it's important to note that we are watching these things very closely. that if unusual stuff does occur, they will be picked up, and people will be notified. And again, balance that, as we mentioned earlier, against the risk of getting COVID and having something bad happen as a result of getting COVID.
And speaking on the risk of getting COVID, the next question was, what's worse, COVID-19 or the vaccine?
COVID-19.
Yeah.
Hands down.
Yeah. An ounce of prevention. What is the statement? An ounce of prevention is worth a pound of cure. You know, I mean, what number are we at? 630 something thousand people have died in the span of a year and a half from this virus. The vaccine hasn't come anywhere near that number.
I think the vaccine is in single digits.
Yeah, I mean, like we could count it on one hand, maybe two, right? And even people that I know who've had both the virus and the vaccine, they still say that the virus was worse. I know a family physician who got COVID-19 very early in the pandemic, and he is still suffering memory loss. Mm-hmm. So imagine, you know, trying to run a very busy community-based medicine practice, and you can't remember what your patient just said to you a few moments ago, or what it is that you wanted to prescribe your patient. The long-term effects of COVID are life-changing. 1 in 5 people who experience long-haul COVID have to go out on disability. So what does that do, like in terms of destabilizing a family and completely upending someone's lifestyle? So you've survived this horrible infection, and now you can't support yourself. I mean, it's really not even a fair comparison if we put the vaccine head to head with the virus itself.
I think one of the things when often we're having conversations with different community members is that particular question. It's one of the, depending on who you're talking to, that's sometimes the gotcha question, you know, like, oh, well, because there are these instances where people have had some adverse events related to the vaccine, it's the worst of two evils, so to speak, right? And the idea of what the long-term effects are. I mean, we are now starting to see the long-term effects of COVID. And we still have no ideas just how bad it is, because it is such a, the number of systems that the virus can actually affect. The number of, places within our bodies that the receptors for the virus reside means that some of the things that we will, start to identify later on in people will probably surprise a lot of folks in the future.
Glenn, I think that's a really good point. Actually, it actually goes for, and I'll answer Camilla's question in a second. But I think it goes to the point with all vaccines. I'm old enough to have also, besides having gone to the polo grounds, I'm also old enough to have had measles when I was a kid, and I was fine. But one of the first patients I took care of when I was a medical student as a third year at Kings County Hospital was a woman my age who was at that time 23, 24 years old, who had measles when she was a small child and had encephalitis, had the brain inflammation, and basically couldn't talk and couldn't move her arms and legs, and basically was in and out of the hospital all the time for pneumonia, and eventually she died. These diseases that we have vaccines to prevent of, can really cause incredible problems, and we get lost in some of the smaller issues, and the more uncommon side effects. And the reason why we talk to our parents or grandparents about what it was like in the summertime when there was polio around. People did not do anything. To Camilla's question, I mean, theoretically, you're right. There's nothing that we cannot say will never cause or be impossible to cause any complication. However, from a medical standpoint, and Glenn, you may have some comments on this as well, the likelihood of this happening in terms of from a mechanism standpoint or a physiological standpoint is essentially zero. And again, balancing this against the likelihood of getting COVID or some other problems really has to be taken into account.
Absolutely. I think, when we actually start breaking down how these vaccines work and how all vaccines work, for the most part, the likelihood of a substantial long-term effect that is entirely because of the vaccine is it's almost impossible to imagine. Now, there are instances where people have some congenital issue, some issue that they had before they received the vaccine, becoming engaged, becoming activated. But again, that is a rare event. I mean, so rare to the point where it might not register on any of the surveillance systems because this is just that rare. I think there might be one instance of someone who may have had like Guillain-Barré syndrome or something along those lines. Again, it's not super common. So I think when we actually follow the science, the same that we've been following all the way up until 2019, we see that the vaccinology in and of itself still functions by the very similar mechanisms. We haven't changed the immune system, between the beginning of the pandemic and today. What we're doing is just engaging these things that we've been doing and utilizing to protect our communities, protect our countries for decades at this point. And the proof is in the pudding. The statistics on what has happened pre and post administrations of some of these different vaccines to eradicate some of these diseases, it's mind-boggling how the numbers go from very high to next to nil once those vaccines are in people's hands, in the hands of healthcare professionals.
And one more thing that I'd like to add is that we're talking about a hypothetical problem in the midst of an actual problem. Like right now, today, and for the past 18 months, and for the foreseeable future, COVID-19 is going to be a part of our lives. We will still be masking, social distancing, schools closing, work from home, can't get on a plane. Like that is our everyday lived experience, and it will be for, until this is over. The hypothetical problem of, will I get cancer 40 years from now? And this is just from my personal perspective. If I have a real chance of not surviving this actual problem today, the pandemic that we're in right now, it doesn't matter whether I'm going to get cancer 40 years from now. If I don't survive the next 40 days, then cancer 40 years from now wouldn't even make a difference, But as both of our doctors have said, it's unlikely. I mean, I am not at all aware of any vaccine that has caused severe health problems decades from the time it was administered. Like that's just, I can't even think of a single example. There was one brand of this one vaccine. I cannot recall a single one that I haven't learned anything to that effect. But again, our actual issue versus hypothetical. And if we have to make a decision, we have to make a decision based on what's actual and not what might happen maybe sometime down the line at an unforeseen date that we might not even live long enough to get to.
Thank you so much. And we had another question here, but I think it's probably some of the similar answers you've provided. They want to know about chickenpox and shingles. So we're gonna go ahead.
That's an interesting question.
Okay.
And the reason is if you think about what shingles. Shingles is when we as adults, well, obviously kids have been vaccinated, but most of the adults have had chickenpox as a child, and as an adult, the chickenpox reactivates, and usually reactivates in a specific way. The reason it's an interesting question is the things that cause us to reactivate are usually some type of severe emotional distress or or physiological body inflammation. There's some inflammatory response. So when somebody gets really, really sick, physically sick, they can actually get shingles. Similarly, if you get a severe febrile reaction to the vaccine, it's theoretical you could get shingles. This is again something which has nothing to do with the vaccine itself. It's basically the fact that shingles occurs when you have severe inflammation of some sort going on in the body. So I would not be surprised if we saw COVID causing shingles.
Thank you for answering that question. So we actually need to wrap up on this portion of the event. We have one more thing we want to cover, but I want to thank you all for participating and sharing all your expertise and your insight. Very, very valuable. And for those in the comments who have more questions, we'll probably be sharing some emails soon before the end of the event. So you want to contact any specific panelists, you can email them directly and ask your questions. So thank you to the audience too for joining us. So now I'm going to have Dr. Burley go ahead and talk about a study that we're doing, and hopefully you're interested in joining. Feel free to join. But in the meantime, I will go off camera, and so will everyone else. So thank you again, and we'll be back in a minute.
Thank you, Khadijah. Thanks to all of our esteemed panelists and guests. A lot of the conversation during today's event has been around the importance of vaccines and protection, and that remains to be true. But we also continue to do other work of discovery, mainly work that wasn't necessarily done in the initial vaccine trials, questions that were not necessarily answered in the sense of whether or not vaccines prevent against infection altogether, or whether or not vaccines protect against transmissibility as well. That wasn't the mandate of the initial vaccine trials of last year. The mandate was just simply to see whether or not there was an immune response and if there was a certain level of protection against severe illness and against death. We've answered those questions, and millions of people have safely participated in the vaccines as a result of those questions. But there are still other scientific questions that need to be answered. And we understand that there are still people who might not necessarily be comfortable participating in a vaccine. So we want to be able to provide options for those people to still contribute to the science that will maybe help us learn more about this disease and this pandemic so that we can prevent against the next. So I want to briefly share with you all some information about a study that might be of interest to our audience. And I'm going to share my screen really quickly. Okay. And so I'm going to talk a little bit about the COVID-19 Prevention Network 3006 study, or the Prevent COVID-U study. This particular study is a study of the Moderna COVID-19 vaccine against the SARS-CoV-2 virus, which causes COVID-19 disease. Many of us have received the Moderna vaccine. It is one of the messenger RNA vaccines that have been available to us in 2 doses. This particular study wants to analyze whether or not the Moderna mRNA vaccine prevents against SARS-CoV-2 infection, and at what level, or if it prevents against SARS-CoV-2 transmissibility, and at what level. The study will enroll up to 18,000 adults between the ages of 18 and 29 in the United States, and up to an additional 38,250 people who will be enrolled as close contacts. And I'll talk a bit more about what close contacts mean. But again, the main research questions, because all clinical trials are foundationally built upon these research questions. We want to know, does the vaccine protect people from getting infected with the coronavirus called SARS-CoV-2? And does the vaccine prevent people from transmitting SARS-CoV-2 to others? We have our ideas about these questions and the answers to these questions based on what we've seen in the general population. But we don't necessarily have scientific data that can be replicated and peer reviewed to verify those ideas. And so that's the purpose of this particular study. So there are 3 different groups that can be a part of this study. The main study, again, will enroll people between the ages of 18 and 29, excuse me. But they are people who have not tested positive for SARS-CoV-2, all right? So you haven't had COVID-19 infection, and you have not been vaccinated for COVID-19 up until this point. Now, as of today, about 50% of the U.S. population has been fully vaccinated. About 60% of the U.S. population has received at least one or more doses of their shot. If we talk about people over the age of 18, people who would be eligible for this study, we've seen about 71% of the people over the age of 18 who've received at least one shot. And so that leaves about 30% of people over the age of 18 who might potentially be eligible for this particular study, depending on whether or not they are older than 29 or younger than 29. And so we're still talking about, potentially upwards of 80 million people who could possibly fit and qualify for this particular study based on demographics. So these people between the ages of 18 and 29 who have not had COVID-19 and have not been vaccinated will be randomized to either get vaccinated immediately or to get a delayed vaccination in 4 months as a part of the study. So those are two. That's one group. The other group will be an observational group of people who decline vaccination. And so these are people who I'm not comfortable with it. The FDA hasn't fully approved the vaccine, and I'm going to take my chances with, adhering to the guidelines and keeping safe that way. You too can contribute to the science of COVID-19 as a part of the control group. Most of the same study procedures will take place with this group as with those who are participating in the vaccine. And then at the 4th month study visit, the vaccine will be offered to those who did not want to be vaccinated in case they change their mind, right? And so you get time to learn more about the vaccines, to actually engage with the experts and professionals. And over the course of time, maybe you'll change your mind about whether or not you want to participate. But that is not a requirement of this study, that when you get to the end, you agree to be vaccinated. And then there's the third group, the close contact groups. And this is anyone in close physical contact to the main study participants, those people who will either be vaccinated or those people who have chosen not to be vaccinated. And they can be invited to the study as well. And that makes up friends, roommates, family. These contacts can be invited to join at any time the main participants join, or after the main participant has had a positive SARS-CoV test, because again, this test is really trying to answer questions about exposure, infection, and transmissibility. So just to kind of further give you an idea of where you might fall if you were interested in this group. First, we'll assess a person's preference for vaccination. If they don't have a preference, then that person will be randomly assigned to either an immediate vaccination group or a standard of care group. Those are the people who will get a vaccination in 4 months as opposed to right away. But if you prefer no vaccination, then you will be in the control group. And that's what will make up those participants. And then from all of those groups considered, any close contacts can also be enrolled in the study as well. Among the people who want to be vaccinated, half of the study participants will get vaccinated in the study immediately, and half will get vaccinated in the study 4 months later. Participants will be randomly assigned to these two groups. So we have no say in whether you get the vaccine immediately or later. And if you're in the group that gets randomized to the delayed vaccination, the 4 months, but you decide that you want to get vaccinated sooner, you can do that. You just have to do it outside of the structure of the actual study. Then the observational group, the control, if you will. These are people who don't want to get the vaccine. They'll have the same visits and the study procedures as the two main groups, but they won't get vaccinated. And at the month 4 visit, they will be offered the chance to get vaccinated in case they've changed their mind. If they do wish to get vaccinated at the time, they will go one more visit at month 5 to get the second dose of the vaccine, because again, this is the Moderna 2-dose vaccination that is being studied here. These are some of the things that a participant who's enrolled in the study will have to do. Their daily nasal swabs for about 4 months. You'll be giving all of the swabs that you need for that 4-month period. and then you'll be able to return those swabs either to a drop-off location or by mail. And then you'll record your nasal swabs using a barcode that you can scan with your smartphone each time you complete a swab. And of course, you'll be compensated for all of the swabs that you return to the clinic. If you get tested for COVID-19, the study asks that you record any test result in the e-diary that you also have, but it's not mandated of the study that you get tested. So this is the COVID-19 Prevention Network 300 study. These are the people who have made this study possible, and definitely want to acknowledge them. But really, those of you, the audience, people in your families, people in your networks, are really the folks who are going to drive this study. And again, it's an opportunity to continue to contribute to research, even if you're vaccine hesitant or if you reject the vaccine wholesale. This is a way for you to still contribute to the COVID-19 pandemic without having to compromise your values or your morals or your belief systems. And it could be a contribution to help us understand just how the vaccines work outside of preventing severe illness and death. Do the vaccines actually reduce transmission? Do the vaccines actually prevent infection? And if so, at what level? And so these are important questions. And for more information, you can visit www.preventcovidu.org, www.preventcovidu.org. All right. I'm going to ask Lewis if he will put that website in the comments for our viewers in case people want more information about how they might be able to participate in this particular study. And as we close, I want to thank all of our guests, people who have literally dedicated their lives to this moment, to be able to help us understand the issues that are before us, people who are trusted, people who have prayed for, and families, people who have prayed over those who have fallen as a result of this pandemic, and people who continue to try and bring the information and the education needed to help us get out of this situation to their communities. I want to thank each and every one of you. I want to especially thank my co-host, Khadijah Abdullah. I'm going to add her back to the stream for her partnership and for organizing this particular event for her community. And finally, we want to thank all of you, our audience, our participants, those of you who will continue to engage this content online long after today, for continuing to care enough about your health and about your neighbor's health to spend this time with us, to have questions, to ask questions, to listen to the answers. We thank each and every one of you. And Khadijah, I will give you the final word.
Just thank you. You said it perfectly. Thank you all for joining. If you have any questions, you can email myself or Dr. Burley, and we can put you in contact with the panelist person that you're interested in talking to. I think our emails are up here. Let's see, they're listed. Well, my email is khadijah@habrahma.org, and then we'll put Dr. Burley's up here as well. Ulysses.
I can be reached at ulyssesburley@ubthecure.com.
UBTheCure. I'm going to put it for you right now, and you can contact either of us to make sure you're put in contact with the panelists that you have questions for. All right. Well, thank you so much for a wonderful evening, and have a great night.
Stay safe and stay healthy.
Assalamu alaikum.